Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look at the differences between the CD4. So CD4 and the CD8. So how do you differentiate? The first is the CD4, it has 60% of the mature T cells. So CD4, it has 60% of mature T cells. Then comes the helper T cells. The helper T cells. So there is 60% of mature T cells is helper T cells. Next is there is a secretion of the cytokines. So the secretion of the cytokines, and they help macrophages and the B cell to fight infections. So help macrophages and B cells fight the infections. Next is they also bind to the class 2 major histocompatibility complex, so 2 MHC complex, and are displaying the antigen. Then we move on to the CD8. What is the CD8? The CD8, it refers to the 30% of mature T cells. 30% of the mature T cells, and it also includes a cytotoxic killer T cell. Cytotoxic killer T cell. And there is a destruction of the host cell. So CD8 is the destruction of the host cell, having the microbes like the viruses and the tumors. And it also binds to the class 1 of the MHC, whereas CD4 was a class 2. CD8 is going to be the class 1 of the MHC. So when you look at an easier way of understanding the T helper cell, in case of CD4, the T helper cell, it acts with the antigen of the microbe, and it results in the T helper cells, and it releases the cytokine. So releases the cytokines, and upon releasing of the cytokines, the process such as the macrophage activation, then comes the inflammation, then the B cell stimulation, it occurs. This is where the CD4 helper T cell lymphocyte. Then when you look at the CD8, so in CD8 the CTL combines with the antigen in the cell, and the CTL and the cell, they combine and they join. Next step is where the cell is killed. So this is the CD8 plus cytotoxic T lymphocyte. To learn and grow daily like this, please do subscribe.